I'm Dr. John Kruse, and today I'm going to be talking about paranoia and ADHD. So I'm not talking about situations we know that amphetamines can, in toxic levels, lead to psychotic, including paranoid ideation. Also not talking about full-blown psychosis, sort of schizophrenic-like states where there's some complete detachment from reality. We do know that ADHD is associated with an increased risk for developing a full-blown psychotic symptom, and some of that may well be shared genetic factors for both of those. There seem to be a huge number of very tiny genetic variations, alleles, that are associated with each, and I'm not going to be talking about full-blown. So we're going to be talking about paranoia. It appears in our DSM-5 in two different places. One, so a form of schizophrenia is paranoid schizophrenia. And two, there's a paranoid personality disorder. Paranoia itself is not a diagnosis per se outside of those two flavors or conditions. So paranoia is excessive anger or fear driving irrational or delusional beliefs, particularly of persecutory nature and a conspiracy nature. So it's other people banding together against me. It's probably important also to define delusions, and delusions are defined as idiosyncratic beliefs or impressions that are firmly maintained despite contradictions by rational arguments or generally accepted reality. There's some debate as to whether delusion should include incorrect ideas that are maintained despite rational evidence, like was believing the world was flat or that the sun rotated around the earth, a delusion, even if the majority of people believed in it. I'm not going to get into that battle right now. I'm also going to talk a little bit about the definition of the word gaslighting. So it's a term that's being used widely right now. And I think very often it's being misused. So gaslighting by definition is manipulating. The person gaslighting is manipulating you in a certain way with the goal of making you believe that you are crazy. That's what gaslighting is. There are many times in our society, and we can pick any number of our favorite TV news opinion commentators who are asking leading questions, providing misleading information, sometimes giving outright lies, but clearly manipulating a narrative to make you feel or think in a certain way that is actually not supported by the facts or existence. But again, their goal isn't to make you feel crazy. The goal is just to deceive you. I would argue we should not be using the term gaslighting if someone's just deceiving you. You might actually feel that you have been gaslighted or gaslit because you're questioning your own grasp on reality. But again, I would argue they are not gaslighting you if their goal is just to lie to you, not to make you believe in the specific idea that you are losing your mind. Paranoia is associated with a couple of different thought patterns and behaviors. So it's associated with false accusations, so accusing others that they are doing things they're not. It's associated with general distrust of others. It's associated with what's called a sinister attributional bias, so that you are more prone towards thinking that certain events or coincidences or accidents or incidences are happening through intention and are planned rather than just an accident. Thinking all of this is directed at you or is about you. So there's a overemphasis on the importance of yourself, overly believing or endorsing that society is more connected, coherent, engaged in acting as a unitary whole than most people's experience. And I would argue objectively, evidence shows about how society is working, is operating. Since some people have a hard time accepting or grasping that there's any connection between ADHD and paranoia, the example I'm going to bring up is something that came up in a couples therapy session. So the guy has ADHD, the woman doesn't in this particular couple. It came up that they had their anniversary and the guy with ADHD showed up 2 hours late for their anniversary. And when she confronts him during the session, his first response is, "You didn't tell me." And then when she explains and points out the specific instance and the emails that she had sent, reminding him and discussing it ahead of time, he jumps or switches into a paranoid mode where he's saying that you're always criticizing me, you were setting me up, I wasn't going to check that email this day, you're manipulating me. His real experience seems to be that he hadn't been told in this scenario. It did seem that she had told him more than one way, and that his inattentiveness led to him missing information. But rather than acknowledging he might have missed information, he jumps into a much more defensive mode, and not just defensive, but attacking that she's created the situation. His experience was she was gaslighting him, that she was saying she had provided information she hadn't to make him feel crazy. So he was feeling the whole world was stacked against him and feeling at a deeper level, which I don't think he could acknowledge, that his own flaws, keeping track of time poorly, listening and being attentive when important instructions were given, his own flaws were being exposed, but it was less toxic to him to project his insufficiencies onto the world at large and come up with the scenario where people were against him. Paranoia, again, can exist on a spectrum of severity or pervasiveness, verge into the fully psychotic, completely detached consistently with reality. Or some people would even put social anxiety on the spectrum of paranoia, where we're being more mistrustful, more thinking that others are intentionally thinking bad things about us, harassing us. Children who have ADHD, the likelihood of developing a personality disorder, particularly paranoid personality disorder and borderline personality. And borderline personality, there's certainly a large extent of paranoid thinking. Development of personality disorders is 5 to 8 times higher among kids with ADHD than the general population. And again, there's some evidence that this is not just the result of low dose of stimulant medications or toxicity from high doses, but completely separate from any exposure to stimulants. So what are some of the risk factors when people looked at who is prone to becoming paranoid? The intrapersonal, so within the individual factors that seem to rise out, is one is a feeling of powerlessness. If you feel that you don't have much control over your life or destiny or course of action, that can lead to it. So how does ADHD fit into that? One is that many people with ADHD feel a sense of powerlessness over their own ADHD. They didn't ask for it. They can identify which parent or parents they inherited some propensity for it from, but they're aware that there are situations where they are behaving in ways, whether they're more impulsive, less attentive, that is causing problems in their life, but they feel powerless to change that. Many people in society at large are feeling more powerless right now because there are big forces that we are more aware of than we have historically been. Things like global warming, racial injustice, a war that keeps threatening to be on the verge of nuclear war going on in Ukraine, COVID epidemic. There's a whole host of big negative forces out there which engender a sense of powerlessness. Depression is a risk factor for paranoia. So that's associated a little bit with powerlessness, but is a separate construct. We know that depression and ADHD are linked, that if you have ADHD, you're more likely to develop it. And rates of depression, again, some COVID related, some I think related to some of these other bigger social issues, have been increasing society wide. Feeling isolated. Many people with ADHD feel like they're alone or separate from others because of their condition. And there's a host of factors, largely, I would say, social media and fragmentation of our lives and focusing on our phones rather than the people right in front of us. COVID lockdowns and voluntary self-quarantining have all led to isolation at a societal level. Moving into not just intrapersonal, but also interpersonal, how people interact together. Having parents that were extreme disciplinarians who were stringent and also particularly inconsistent or unstable, but very demanding, leading to a sense that as a kid that I'm always failing them, that is a risk factor for developing paranoid thoughts. Classmates, peers, teachers, parents, whether or not they specifically are aware of the diagnosis, are often aware this kid is acting differently and are treating them differently. But they're not listening when I give directions. They're more disruptive in class. So they're getting more negative feedback. There's an accuracy to their perception that people are looking at their behavior and singling it out and finding it faulty. The psychology theorizing is that much of paranoia is sort of projection onto others, that you're blaming others for your own incompetence or problems navigating life. Some of these overlap with what I was just saying, but perceiving that you are in a socially distinct group is a risk factor for developing paranoia. Clearly, people with ADHD are a socially distinct group. They have this label or this diagnosis. They know that parents, teachers, coworkers, bosses may discriminate against them because of that. In the world at large, many white people never even had to really think about being white people as an overwhelming majority. But now that that majority is shrinking, now that topics like the Black Lives Matter movement, like violence against Asian Americans, is making everyone more aware of their social categories, that they are socially distinct. And if they're socially distinct, that means others may be evaluating, scrutinizing them. People in our TikTok social media culture where you have to respond immediately, you have materials presented at you, you have to either like it and swipe left or right, or choose right away whether you like it, whether you approve, because something else is coming up in another millisecond. Measurably, people are coming to conclusions more rapidly, which means they have less time to consider them ahead of time. And because, again, another decision's coming up next, there's something else holding our attention, there's less time or space to step back. And that's true both the ADHD community, because switching attention is challenging. It's not just whether you're distractible or whether you can maintain or sustain focus. It's how well you can voluntarily step back and switch focus. There's a lot of interaction also between the topic of right brain, left brain. The left brain is the one that's making rules, making generalizations. Those are useful sometimes, but they're using narrow sets of rules to try to explain broader problems. And it's the right brain that actually sees more globally, has more information, is more accurately perceiving the relationship of this fact to this holistic everything that's going on. Switching out of left brain mode to right brain mode may be helpful in avoiding paranoia or getting out of paranoia. But again, part of it is once we form a set of beliefs, people don't like to acknowledge being wrong. So it's hard to move out of them. Some of the other ways, and these are more if you want to prevent yourself from developing paranoia, one of the little mottos I came up with, and this was more than 30 years ago, so before Fox News, before Trump's accusations of the fake media, but my little motto was, you learn something wrong every day. Now, you don't always know what's wrong, but people are full of misinformation. Some are full of disinformation. Some are actively trying to confuse you, lie to you, but some of them are just, they learn something, they think it's true or accurate, and they pass it on as wisdom, and it's wrong. So I recently moved to Hawaii. I'm interested in figuring out ideas for gardening, and some friend told me, meaning well, something about a certain group of plants, and made sense, sounded reasonable, but when I checked it out, it was completely inaccurate. And I don't think they were trying to misinform or disinform me, but if you have at least some skepticism that some of the information is wrong, you're on sturdier footing than if you think everything from certain sources is completely reliable and 100% true. Second little motto that I came up with years ago is along a similar line, but a slightly different point, is all generalizations are false. Now, of course, that's a generalization. So that one's false by its nature. And if it's false, that means all generalizations are true, which would be false. And then the third rule of thumb that I work by is that there are many more problems in life that are caused by incompetence than by malicious evil. I'm not saying there isn't evil intent and people trying to harm others. We can clearly see that. But so much of the misunderstanding, so many of the things that go wrong, so much of the failures that cause grief, real harm, including life and death situations to others, are more often through incompetence than evil. And I believe that we can actually demonstrate that, whether or not you want to believe that one or not. Have a healthy, happy week.